You may never have considered that you might have anxiety, maybe writing off worries as just life. And you might think being labelled as anxious is something to be embarrassed about or that it comes with stigma. But do you know what anxiety really is? The truth is, anxiety can affect anyone and it can affect us differently throughout life as our worries or pressures change. And when it starts to impact on your day-to-day life, then it might be time to get some support. So let's have a chat with the expert. I'm here today with Bianca Clarke, Bupa cognitive behaviour therapist, and we're going to get to understand anxiety a bit more. So firstly, Bianca, how do we define anxiety?
So anxiety is a really common natural human response, and it's our body's response to a perceived threat, danger, or some kind of threat that our body perceives may be there. It can come with a wide range of feelings. So it can come with physical symptoms such as trembling, shaking, breathlessness, heart racing, lots of different uncomfortable physical sensations. But it can also come with stuff in our mind as well. So we might find that we have racing thoughts, or we might find that our thoughts just feel really jumbled and we can't quite make sense of them. It may lead us to avoid things. It may lead us to change our life in some way. We might adapt to the worry or the anxiety that we have. And it can really get in the way of the things that we want to do, the things that we love doing, and really sometimes can hold us back.
So, as you say then, physical symptoms, it can be emotional symptoms or even changes to behaviours. Is it different then to just feeling anxious? And how is it different?
So feeling anxious, I often see that as a bit more short term, quite situation specific. And once a situation has passed, the anxiety starts to drop down again. So it might be, for example, that we have a big meeting or we have a big life change or adjustment coming up. You find, the anxiety goes up and it peaks. And then once it's done, you feel relief, the anxiety starts to come down. Whereas having anxiety is a bit different. That's more chronic, longer term, longer lasting, and can really feel quite debilitating on a person's life. Sometimes we will really notice the impact that anxiety is having on our life. Other times we might mould our life around the anxiety and we don't even notice that it's there. It's just that we've changed our habits, our way of doing things, and that just becomes the way of doing things. But actually, sometimes it could be anxiety that's making us do that.
And are there lots of different types of anxiety?
There's lots of different types of anxiety. We often refer to them as anxiety disorders, and each anxiety disorder has a specific focus for the worry or the anxiety. So, for example, generalised anxiety disorder, also known as GAD for short, that is where we worry about anything and everything. So it could be something quite small and it becomes bigger and bigger and bigger and spirals out of control. We have anxieties like panic disorder. Panic disorder is where we worry about our physical symptoms and what they might mean. With anxiety, it does come with uncomfortable physical symptoms, but those particular things we might then worry about. We might then think they mean something serious is about to happen to us in that moment. So, for example, if my heart is pounding, I might worry that I'm about to have a heart attack. Or if I feel dizzy, I might worry that I'm about to faint in that moment. We've also got health anxiety, which is worry about our health or the health of our loved ones. And often we're not worrying about a cold or something like that, but it's often those more severe, serious illnesses that we worry about. Things like cancer, dementia, or even heart problems. We can have social anxiety, which is worry about social situations. It might be being around familiar people or unfamiliar people that we worry about. But in social anxiety, we might fear judgment or criticism from other people. And again, it might just make us avoid situations. So there are lots of different anxiety disorders, and for some people, they might be experiencing a few of them at the same time. So it's really important to make sense of it with a qualified professional that can then help you to manage it and move forwards.
I guess one of the key reasons why it's important to identify it is you may have found ways to live with it, but you therefore might not be living life to the full. And if there is a way to manage it, then that might actually improve your quality of life. So how can people recognise it, both in themselves and in other people that they care about?
So in ourselves, because we can hear our own thoughts and we can feel what's going on in our bodies, quite often people will notice where their thoughts take them. So it might be worries about finances, or it might be worries about upcoming retirement, and they will know what the content of their thoughts are. So that's something that you can notice in yourself, but also those physical feelings as well. Sometimes they can come on really quite strong It can feel like they come out of the blue, and that is often one of the first things we might notice in ourselves as well. In other people, because we can't hear their thoughts or see what they're feeling physically sometimes, we might notice their behaviours a bit more. So we might notice that someone is pacing up and down. We might notice that they come to us a lot with worries and lots of what ifs that are on their mind. We might notice that they check things over and over again, or that they're avoiding certain situations.
And can everyone's experience of anxiety be different?
Everybody will experience different symptoms, and there might be some symptoms that don't feel like they initially relate to anxiety. They might not be so common. So it can really vary, but it can also vary in the intensity. Some people feel it really strongly, others less so. The duration of how long they last, but also the frequency of how often they come up.
And what causes it? Is there a cause? Is there a range of causes? What are the common causes?
Anything and everything can cause anxiety. It just depends on the person. But some really common causes that I see in my clinic are things like work stress, or even the idea of retirement and thinking about what are we going to do after retirement? How am I going to live my life? Worries about family may be moving away and kind of separating a little bit. There could be worries around menopause and kind of the hormonal changes that go on in our bodies. There could be such a wide range of things to worry about and be anxious about.
And do we tend to see those causes changing as we get older?
So across the lifespan, there does tend to be typical worries and anxieties that come with different groups. So when we are in our teenage years, often it's peer pressure, exams and things like that. As we get into our working age, it's normally work stress, worry about mortgages, family, homes, all of those kind of things. And then as we get more into our retirement age, we might worry about retirement and what that looks like. It might be the loss of loved ones as we start to lose loved ones in older age, and what that then might mean for our family or ourselves. And also financial instability, physical limitations. It can really vary across the lifespan.
So why is it important then that people reach out for help if they're struggling with anxiety?
It's really important because it can feel really confusing. And for some of us, we might not even know that it's anxiety. Anxiety is a term that we might use as medical professionals, but for some people it might just be feeling off, feeling out of sorts, feeling on edge, uneasy. And if you are feeling anything like that, it's just worth having a chat with a qualified professional just to see, what's going on here, what am I feeling, and just trying to make sense of it so you know what to do with it going forwards.
Okay, well, thank you so much, Bianca. Some incredible advice there. And remember, if you're a Bupa customer, you can head over to the My Bupa app, where you'll find lots of resources such as mindfulness tools and wellbeing guides.